now we're videotaping, and we're gonna, so I'm talking to Allison. She's a social worker here at Swedish Edmonds. And what do we do for our discharged, when we're discharging a homeless patient? How do you get that all together?
We often don't. So we meet with the patient.
Mm-hmm.
Can you see me? Hello. So I feel like we do a really poor job discharging homeless patients. We meet with them. We often throw resource lists at them that they know far better than we do, the resources for shelters and for assistance within the community. But we don't do enough to make sure that their medical needs are met, especially. That's what your focus is, right?
Well, yeah, our
Okay.
focus is on medical follow-up care when a patient is discharged.
Right.
And frequently we send them we give them a resource to one place, but they're going off in a different direction, and they shop around and they don't follow with a primary care provider.
Right. Yes. So, unfortunately, I feel like social workers and the medical team, we feel like we can say, okay, we've made this appointment at the community health provider. You know, we're filling indigent medications, perhaps. We've done our job, but we know that there's 500 barriers that are going to prevent them from getting to that follow-up appointment. And if we were to spend a little more time with them and really dig down into what they really need, what their goals are, how we can make it possible. So it starts with more time to really explore their individual situation, their resources within their community or not, and what they want and think would be options as far as getting the medical, the continuing care and the medication so that they don't have to come back to the hospital in a crisis.
Do most primary care providers that you send them to have social services available?
I don't know. I don't know that they do. I doubt that. I doubt that they do. I know that some of the local clinics, the community health, where they have a higher population of self-pay or Medicaid, they do have some resources. Often there are social workers within these managed Medicaid plans, and they try to follow the high utilizers, the patients that have been identified that are going into the ER frequently or have a lot of hospital admits. But again, I suspect that their caseloads are high, and just like the hospital social worker, we're not spending enough time with this population to really make a difference and set something up that's realistic.
Do you think that if discharged patients had a list of facilities that had social services, and specifically our diabetic patients, if they have diabetic nurse educators and nutrition counseling, would they?
That's key. Yes, that would be helpful.
Okay. So our little team is going to try and
Yay!
work on that.
Okay.
Okay.
And not only do we have a list, but can we build relationships with those social workers and call them and say, hey, we're referring this patient, on a follow-up visit on this day, and this is what we hope to set up. Please follow up and see that they, are getting these medications continued, or whatever the issue is, and have a pass-off. I think that would really help.
Sounds like there's a lot of work to do in this area.
Totally.
I think I've got projects ahead of me.
Please.
Okay.